Hello, I'm Ben, and if you're in your final year of a dental program of study, this video is for you. Before you can start practicing, you must be registered with the Dental Board of Australia. To help you understand what this means and how to do it, I'm going to have a chat to Sarah, who is finishing her course soon and has a few questions. Hi Sarah, how are you doing?
Good, thanks. How are you?
Good, thank you. So where should we start?
Well, I'm finishing my course soon and I've heard that you need to be registered to work, but I'm not really sure what this means.
We have a scheme called the National Registration and Accreditation Scheme for 14 health professions, including dental practitioners. AHPRA and the national boards work together to implement the scheme, which regulates more than 650,000 health practitioners across Australia.
What does a national scheme actually do?
One of the main objectives of the scheme is to keep the public safe, and we do this by ensuring that only health practitioners who are suitably educated and qualified to practice are registered.
Okay, and the dental board, who are they?
The dental board regulates registered dental practitioners.
If that's the dental board, what does AHPRA do?
AHPRA supports the board and the national scheme, and so it's AHPRA who actually manages your application on behalf of the board and then publishes your name on the online register.
So I've had a look at the board's website and it says that there are a few requirements I need to meet to register.
That's right, you must meet the board's registration standards in order to be registered.
What are the registration standards?
The registration standards state the minimum requirements you must meet in order to be registered, and they can all be found on the board's website.
There seems to be quite a few. Do I have to meet all of them?
The ones which are relevant for you right now are firstly the English language standard.
Great, I speak perfect English.
You do, Sarah, but you still have to meet the standard. Every applicant for initial registration must demonstrate their English language competency, so have a look at the standard and read it carefully.
Okay, what else is there?
You must disclose any criminal history you might have.
Hang on, I got a speeding ticket last year. Will that affect my application?
It shouldn't, but it's important that you disclose everything in case it's relevant. AHPRA does its own criminal history checks, so make sure you tell us everything.
Okay, and anything else?
You must have PII.
What's PII? I know it's something to do with insurance, but I'm not sure.
Every registered dental practitioner must have their own or third-party professional indemnity insurance that meets the registration standard. And it'll have things like, it'll cover you for all areas of your clinical practice and all places that you practice.
I was actually thinking next year I want to go overseas for a year before I start work. Do I still register when I finish my course?
That's a really good question. It's important that you register and start practice within 12 months of completing your studies, otherwise you might not meet the board's recency of practice registration standard.
Okay, maybe I'll take a shorter trip.
Might be a good idea.
So how do we actually apply for registration?
You can apply online about 4 to 6 weeks before you complete your program of study, so head to the board's website and carefully follow the steps to complete the online application.
Okay, that sounds easy.
It is. We will assess your application and your education provider will confirm with us when you've successfully completed your program of study. It's really important that you make sure you use the same name on your application as you do on your identity and enrolment documents.
Okay, and how will I know when I have successfully received my registration?
That's a really good question because many students are keen to start work. So once it's all done, AHPRA will send you a certificate of registration and your name will be published on the online register. And it's really important that you don't start work until your name is listed.
So what happens once I'm registered?
You must continue to meet the board's registration standard, codes, policies and guidelines, so do make sure that you've read them.
Do they change much?
From time to time the board updates them, so go to the board's website and check for new information. The board also publishes an electronic newsletter which is a really helpful way to stay up to date, so do make sure your email is current so you can receive it.
Is there anything I should pay particular attention to?
Look, they're all important, but the Code of Conduct is a really useful starting point. It talks to you about how you should behave and that you should provide high quality care to patients.
And will I need to do any further study?
You've got to start thinking about your continuing professional development, so do read the registration standard and the guideline on CPD, and it's really important that you meet your minimum requirements for the cycle.
What sort of treatment can I provide once I'm registered?
You can provide treatment for things which you've been trained and educated for and in which you're competent, so do make sure you work within your scope of practice.
And one last question, will my registration last forever?
Not quite. You must renew your registration each year, and at that point you let the board know that you've met your obligations. It's really important that you make those declarations honestly, as you may be selected for an audit.
Okay, well, I think that's all my questions and that's been really helpful. Thank you, Ben.
Great, thank you, Sarah. It's never too early to find out what's expected of you, so have a look at the board's website. And congratulations on starting your career as a dental practitioner.
you.